afternoon, everybody. Welcome. Today's battle rhythm, encouraging veteran engagement with whole health, will be hosted by Jeanette Gillis. And Jeanette is the director of the Network for America's Warrior Partnership. The network provides local serving veteran organizations with a connection to national resources when a request cannot be met locally. To find out more about the network, please visit americaswarriorpartnership.org/the-network. That's it for me. Jeanette, the floor is yours.
Hello, everyone, and thank you for being here today. I would like to welcome our affiliate communities, our 4-Star Alliance members, veteran serving organizations, and all of our guests that are joining us today. On our agenda, we have today Ronald B. Rutherford. He is the VA Office of Patient-Centered Care and Cultural Transformation. He's the lead for that whole health outreach program. And we also have Tammy D'Alesandro. She is a Navy veteran, and she is going to be speaking on her personal perspective regarding the VA whole health model. We're going to be having our speakers. After our speakers are done, we'll be collaborating in our breakout rooms, and today's session will end at 3:15. During the presentation, if you have questions or that you would like to ask, please feel free to put those in the chat box, and we will get to those as time permits. Ronald, are you here? I see you're there, so I'm going to turn it over to you.
All right, awesome. Well, I am going to get my slideshow up. Good afternoon, everyone. My name is Ron Rutherford, and I am the lead for VA Whole Health. I do the outreach for the Office of Patient-Centered Care and Cultural Transformation. Our office has probably one of the longest names in the VA, but I represent the VA model of whole health to all of our VSOs and our veteran nonprofits. And a little bit about myself. I'm coming to you from Pittsburgh, PA, where I live. I'm retired Navy, 26 years active duty, retired as a senior chief independent duty corpsman. I've been with the VA since I retired, 2011, and I was very fortunate to get on with this brand new office in 2011 that was really promoting patient-centered care and whole health. And over the years, our mission has just gotten so much more. And what I'm talking to you about today is really the genesis began in 2014 with the Opioid Reduction Act. Veterans and our citizens across the country were they were at that point limited in how many opioids they could get from their providers, where many in the past had not been limited. So a lot of our veterans were looking for alternative ways to control their chronic pain with the reduction in opioids. So a lot of them turned to complementary and integrative health therapies. And we're going to be talking about those today, but the whole health model is so much more than that. So I'm going to start my slide deck here. Let me get my cursor there. If any of you are not familiar with Dr. Atul Gawande, he's a physician, alive and well. He has consulted with the Biden administration on the COVID pandemic. But this is a great quote that's attributed to Dr. Gawande. You know, we've been so wrong about what our job is in medicine, as we think our job is to ensure health and survival. But really, it's larger than that. It's to enable well-being. And well-being is about the reasons, people wish to be alive. Those reasons matter, not just at the end of life when disability comes, but all along the way. And that's what the VA model of whole health hopes to be for veterans. It is teaching them how to live healthier and fuller lives. And this is how we intend on doing this. This is our model. And what you can see down in the lower corner, the one with personal health plan in the middle, this is how we're going to attain this. Our whole health model encompasses 3 different parts: the pathway, well-being programs, and the clinical care that the VA does very well. The pathway is where we empower veterans. We usually these are veterans themselves who are assisting veterans. They are doing facilitated classes around self-care with our veterans. They may be helping them fill out something called a personalized health inventory. It's a tool that we use to ascertain where a veteran is on their readiness to change. And the well-being programs are where we really equip them with some of the skills and the tools that they need to succeed. We have the VA's got health coaches now. Many of you may not be aware that you can get a health coach with the VA. And we'll talk a little bit more about health coaches as I go on. Well, this is our model, down at the bottom. Hopefully you can see that. But I was talking about our well-being programs where we are equipping them. We're giving them those health coaches, that responsibility piece to help them to meet their healthcare goals. This is where our complement and integrative health that we'll talk about comes in as well. And this is also where some of our veteran peers also support the veteran in this area. And the treat part is where we have trained about 40,000 of our providers. These are the physicians, NPs, PAs, and all the other medical staff that go into a medical facility in whole health. And really, it's about changing the conversation with the veterans. It's really finding out what matters to them instead of really what's the matter with them. What matters to them to help move the needle on some of the disease processes that they may be getting treated for. For that 40-year smoker, who's attempted to quit smoking, numerous times without success. What's it going to take to get them to try one more time and succeed? It's about that diabetic who their blood glucoses, their A1Cs are out of control and may be in danger of kidney failure or some of the other issues that come from chronic diabetes. What's it going to take to get them to test their blood sugar more often? What's it going to take for them to maybe attempt to change their diet? So that's what we explore with the veterans in the whole health model. And our, the definition of whole health is right there in the center. It's an approach to healthcare that empowers and equips our veterans to really take charge of their life and their health and their well-being, and hopefully help them live their life to the fullest. So why are we doing this? So in the United States, you can see this graphic, and it's not a very flattering graphic for the U.S. We spend far more and get less benefits than any other industrialized country in the United States. I looked it up right before this meeting, and you can see this graphic. It's the statistics are from 2015, but the average lifespan for 2023 for an American is about 79.1 years. And we spend around, and the number has actually increased since 2015. We're spending about $12,000 a year average on each citizen, and these other countries are spending much less, but they're living longer than us. So why is our system not working? We want to. We want to be able to give our citizens, our veterans, the best chance at, being like Japan and living, 82 years plus. We're spending 18% of our gross national product every year simply on healthcare. It's unsustainable. So what are the factors that contribute to health? You can look at this pie chart. This is from the social determinants of health. This is from the CDC. And you can see that about 40% of the determinants are social and economic factors. Only 10%, only 10% where most of us seek care when something goes wrong is really attributed to your determinants of health. Why can't we look at those 30% of health behaviors? That's a large piece of the pie. That is a piece where we can really make some inroads to helping our veterans and our citizens in the U.S. live longer and more productive lives. So the big question is, what if we do nothing? What if we do nothing in the next 10 to 15 years? What is our healthcare system? What's the VA healthcare going to look like for our veterans? Is it going to be the same as it is now? Is it going to be worse? I mean, the skies, I mean, anything you can imagine is there. What if we actually spend more time on those 30% of health behaviors? Why don't we help our veterans, give them the resources and tools to live better and healthier lives? And truly, the vision, the vision of whole health is really to reframe how we are practicing healthcare in the United States. It's about helping our veterans to realize health goals that they never thought possible, and to really show them that their efforts, the efforts that they do are going to be rewarded with better vital signs, better health. So the VA, we are really poised for success with this model. We've been doing this for a while. We're the largest integrated health system in the world. And you can see from here, there's a whole lot of healthcare professionals that practice in the outside that are trained. They do some or portions of their training in VA facilities. We do a lot of innovation. We do a lot of research in the VA. We've done a lot of research around whole health, and we have the infrastructure to support whole health. And we have the infrastructure to help the outside healthcare organizations to be successful with implementing this model outside as well. This is something new. This is a report that was generated from the National Academies of Sciences, Engineering, and Medicine. This report just came out in late February, and it was an independent report that really took a look at the VA model of whole health from some of the best and the brightest in academia and medicine. And they come up with 6 goals. They evaluated the VA model of whole health, and they came up with 6 goals. And you can read those right there. I'll pause for a moment. But I've got, my next slide is really going to show what their conclusions were. So their conclusions were that whole health is a common good that benefits everyone. And scaling and spreading it is so widely available requires really a seismic cultural, structural, and process transformation. It requires a systemic shift in mindset about what it means to be healthy, with participation from the top down and bottom up. Multi-sector collaboration, investment, and reallocation of resources. I think outside organizations, one of the first things they're going to ask is, how do we pay for this? This is where the VA is able to model this, a lot easier than outside healthcare systems. And, their last one, which is really profound to me, is the U.S. has made significant advances in treating disease, but we need similar efforts to improve health and well-being and effective, efficient, equitable care delivery. It's about designing a well-being system, not a disease treatment system in the VA and for the country going forward. And you can read this report. It's on the National Academy's website, and it's titled Whole Person Health. Let me warn you right now, it's 284 pages, but there's executive summaries where you can read the highlights of it. So I want to show you some testimonials from some of the veterans that have utilized the whole health system from across the country, and I'll introduce you to Richard here. Richard is a veteran who gets his care at one of the community-based outpatient clinics, or we call them CBOCs. And Richard here, he's 77 years old. He lost 70 pounds in less than a year. And he attributes that to his health coach there at Port Charlotte CBOC. And he attributes to her, his diet, his exercise, and these are resources and skills that he learned with the VA, that he got support from the VA. So he's able to walk 4 miles most days, and he just recently walked a 5K turkey trot too. So here's some of the distinguishing features of our health coaching. Health coaches are not clinicians, but they support the clinical care team. The health coaches, they sit down and they meet with the veterans at intervals that are agreed to by them and the veteran. It may be a biweekly, it may be a monthly meeting. These can be virtual, they can be in person, they can be by phone. So veterans have a lot of options of how they utilize a VA health coach. And it's really about having somebody to talk to about the goals that they have made around their health. And it's that responsibility piece that many of us are lacking in our goals. You know, you feel a little guilty when you meet with your health coach and you said you were going to do A, but you didn't do A during the week, the 2 weeks that you said you told them that you were. So, you know, and it's all about a conversation. It's not really guilting the patient or the veteran. It's about, having somebody to support you. And, the coach's expertise is in that critical piece, that sustainable change. Many of us, may have been on, yo-yo diets where you lose the weight, but you gain it right back. And these health coaches help our veterans to make sustainable change in their lives. They listen mindfully and non-judgmentally, and they really align this with what the veterans' mission, vision, and values are, their aspirations, their plans, and to be present for that veteran. So I want to talk a little bit about our integrative health, which is a large part of our whole health model, but it's only a piece of our model. And the complementary integrative health that our veterans are using, 40% of our active duty personnel and veterans, they use some form of complementary integrative therapy now. That may be chiropractic, it may be acupuncture, it may be mindfulness, or any one of the other myriad of complementary integrative health therapies that there are out there. But we had a survey, and I can't remember what the number was. I want to say it was around 5,000 veterans that were surveyed for this, but about 76% of the veterans said they would use it if it was offered. The good thing about CIH is it's very cost effective. Most CIHs, it's not expensive at all, and veterans and the satisfaction with it is very high, and they get improved physical and mental health symptoms. So these are the 8 complementary integrative health therapies that are part of every veteran's benefits package in the VA right now. And by that, I mean every veteran is eligible for these services for treatment. We hope wellness. We hope to offer these for strictly wellness in the future. And some VAs are doing a very good job of offering many of these for wellness now to the veterans. But for instance, a patient with rheumatoid arthritis would benefit. Their provider feels that they would benefit from some therapeutic yoga for their rheumatoid arthritis. They would write a consult to a yoga therapist rather. And if it is not available in-house in the VA, that would go out on the community contract. But that would have to be for a specific disease process, like rheumatoid arthritis or some of the other ones that yoga is, in fact, effective for. And it's the same for any of these other complementary integrative health therapies. A lot of our veterans are loving the acupuncture that the VA is doing. And you see the picture there, what this gentleman is getting, we call it battlefield acupuncture. It's auricular acupuncture, where they put 5 points in a veteran's ear, and they stay and they fall out naturally, but the effect can last 3 to 6 weeks, usually from the one treatment. The example I love to use is where a veteran may walk into that acupuncture session an 8 on a scale of 1 to 10 in pain. But after some auricular acupuncture, some battlefield acupuncture, they may walk out a 3 or a 4, which is a significant reduction in their pain level. So this is the Reverend Mitchell. He's down in West Virginia, and he's also one of our whole health ambassadors too. He he talks, he says, I was a walking billboard for pain. And his health coach, Mrs. Dobson, and he was able to quit smoking. He's able to do a lot of the activities that he loves to do, but he wasn't able to do because of some of his medical conditions. And this is a very profound quote I love showing. This is a female veteran, and she says, I used to drive over the Mississippi River Bridge to the Jefferson Barracks VA, and I used to think about jumping every time. The whole health system has helped me explore my purpose, find ways to use nutrition and reduce my pain, and use iRest and Tai Chi to get moving again. Now I drive over that bridge and I think about tomorrow. I have hope. And another, Tanisha, Air Force veteran. She uses the mind and body connections, the mindfulness and meditation and yoga. And she's had a lot of benefits from that as well. We have a website. And let me tell you, this website is for our veterans, and it's a public-facing website, and anybody, family members, can benefit from many of the things that are on here. We have so many resources. We have resources if you're researching the effectiveness of some of this complementary integrative health. You can look under our professional resources. We have evidence maps for all 8 of those complementary and integrative health therapies. It tells you what they're effective for, what they're seeing benefit from out of them, and really, what they're, what you don't want to prescribe them for. We are not trading yoga for people's medications. The whole health model and complementary integrative health, they work together synergistically. They complement each other. And this website, we have one of the shortest websites in government. If you go on and you just Google VA Whole Health, I believe it's va.wholehealth.gov. So that's a pretty short one for the government. And we have an app for that. You can go in the Google Play Store or the Apple Store, and you can find our app. And veterans are finding, they're finding that the app helps them to really stick to some of the goals that they're making. They can fill out a personalized health inventory, and there's lots of resources on there. It'll point them to our public facing website. And in the summer here, we've got a significant enhancement where it's going to be connected to their health coaches in their facility. They can check in, their health coach can check in with them, and they can converse together about how their goals are going. And a little bit more about it. That's our director, our executive director, Dr. Ben Klegler. Of course, we had to put his face on the app, and you can earn badges and set goals on this thing. And my colleague I know is on, Andrea Young, and I would be remiss that this is something that she's really been putting together over the years. We've got about 130 videos on our website on so many different topics. And these are open for anybody, not just veterans. The family members can use these. You can go on and learn techniques of how to do some breathing for stress release. You can do you can learn how to do some Tai Chi, chair yoga, some of the more advanced yogas on there. And there's actually one for acupressure. It's similar to acupuncture, but it does not use needles. It uses little points to go in your ear. So I'm going to stop right there, and I am going to show you a video about our guest, my guest that I'm coming on, my honored guest, Tammy. And Tammy produced a video for us. We have a video produced, and it's very well done. And I'm very happy to show you this.
I'm Tammy. I'm a mom, a soon-to-be grandma. My daughter's pregnant for the first time with my grandson. We leave the military not feeling like we have control over anything, and that's how I felt. I was just like, I don't know where to go, what to do. I don't know what I like. I'm not ashamed to say I was in a really bad place. There were days that I didn't want to be here anymore because I didn't know who I was. I learned about the whole health program actually through my primary care provider. I was looking for ways to try to take back control of my life after the military.
My name is Kathy Bixby. I'm a whole health nurse educator at the Washington, D.C. VA. I work with the Integrated Health and Wellness team.
Inhale, the arms up.
Whole health is an approach to care, and it empowers and it equips veterans to take charge of their health and well-being, to live life to their fullest. I mean, that's the bottom line.
I actually took my coach to see me, to kind of, place a mirror in front of me to say, look at who you are.
Open your mind to thinking in different ways.
Veterans can be referred to us as an integrated health and wellness program. We introduce them to whole health. We introduce the personal health inventory, which is a tool we use to invite veterans to do a self-assessment. From that, they can take a facilitated course with other veterans. They can do coaching, individual coaching, group coaching, and then we offer, again, education. So it could be workshops that we're running around different topics, and then we offer the complementary integrative modalities with the invitation to try everything.
Oh, that's awesome.
It's been about 2 years, and this work that I do, I continue to do. It's a daily practice of working out and meditation and mindfulness, and I do practice every single day. So the challenges again are there, but I continue to work through the tools I receive from this program.
Certainly one of the most significant outcomes is a decreased use of opioids by veterans who have participated in whole health. You know, that's a difference maybe between 23% and 38%, depending on what they've taken advantage of. Veterans' perception of care, of their healthcare experience and self-care, their perceptions around pain and anxiety and stress have actually shifted.
The first thing that I've been able to do is be a better mom, be a better partner, just in my home. I truly connect with things differently because I'm not so afraid of what's going on. The other place that I see the most change is in my body, with my weight, my nutrition, with my strength, my flexibility. Everything has changed, and I see that every single day.
It can shift the level of control or the locus of control to the veterans who so deserve that in return for what they have given. It's a gift. It is a gift.
Even though it's not a typical health outcome, I'd say hope drives everything for me regarding my health. This program and the hope it gave me, it saved my life. And I actually made a promise to myself that I would share my own story of healing and triumph in the hopes that it would save someone else's life too.
And it is my pleasure to introduce Tammy. So Tammy D'Alesandro is a Navy veteran. She's a mom, she's a grandmother, free-spirited lover of life, who's on a personal mission to inspire and guide veterans to wholeness and optimal well-being. Tammy discovered the transformational tools and support available through the Whole Health Program after a physically and mentally challenging transition from the military. She's now a certified medical Qigong practice leader, self-love warrior, and a mindfulness movement and meditation guide. She recently retired from her full-time job to travel the world and share her inspirational story of becoming a healed and whole person who has been empowered to take charge of her health and well-being. During her time in the military, Tammy served as a healthcare administrator, managing healthcare programs at Navy hospitals and operational units at bases in the United States and overseas. Tammy has 2 children, Jasmine and Xavier, and the joy of her heart, a grandson named Deuce. So I'm going to quit sharing here, and I'm going to turn it over to my shipmate, Tammy. Tammy, take it away.
Whew, thank you, Ron. That video still makes me cry every time I watch it, like just watching myself, knowing where I was when I made it and where I came from. So just need a moment to just breathe. So grateful to be here with all of you. Thank you so much, Ron and Allison, and to the America's Warriors Partnership for this opportunity to share my story. As you heard, it is truly why I believe I'm here, my purpose. And I know that for a fact, and I fully have embraced that. And I want to do this really to help other people. So honored to be here, and especially in the presence of other veterans. We have this commonality of service, and that's really where I want to kind of focus. You'll hear me, mention that word a few times, because we serve. We are such servants, and oftentimes we're doing a really good job of serving others, and not so good at serving ourselves. And I know I am a living, breathing, walking servant to everyone else but myself. And so what I learned through the whole health program and all the tools and resources was how to start serving myself. And that's really where it started for me. So I know there's tremendous power, in storytelling and sharing our stories. And so again, I'm just really, really grateful to be able to do this and to be vulnerable, because there's superpower, there's huge power in being vulnerable and sharing. And for a really long time, I sat in a place of shame and guilt, about my military career and, how everything happened to me. And now I understand that it all happened for me, that I had to go through every single thing I went through so that I could be here today. And that's truly my testimony. So I'm sure I'll get emotional, so bear with me. This is truly the joy, of my life, is being able to do this, to share and speak with other veterans, and also, to providers, so that you all understand how important your care is to us and for us. I had heard some pretty bad stories about VA healthcare, when I was in the military. And so I did not have a lot of faith about what was going to happen to me as a veteran. As a matter of fact, I kind of put off my disability rating for quite some time. I'm like, I don't even want to go through that process. I heard, such terrible things about it. And it has been nothing but amazing. I've had an amazing team who they have literally wrapped their arms around me and cared for me in a way that I have never been cared for before. And so I want to, hopefully impress upon all of you to understand how important that is to, let the veteran know that they matter. That's one of the things that the whole health program really, really highlights, is that, what matters to me is my health. And it is really, truly what matters most for me. Everything that I do is driven by my health. I have some pretty unhealthy stuff in my family. My father passed away from heart disease. My mom had breast cancer. She's still living, thankfully. But I was aware, of the things that I was that could happen to me. And so I was always very health conscious. And so it was really important for me, to find care that really empowered me to take that, that control of my health and know what I wanted and be able to speak power to that. And the whole health program really helped me with that. So I want to just share a little bit more about my story, though, kind of how I got here. And then I'll talk about like how that all came together for me with whole health. And so I mentioned before this service, and I was really good at service in the military. I had a stellar military career. I did all the things. I was in these great duty stations. And as I got better and better at serving, I got placed in these really high visibility positions and placed on, promotion boards and just really, really impactful. The way I cared for my sailors was, extremely important for me. And I was really riding high, it felt good. I was like, yes, this is where I belong. This feels great. And then I got kicked out. And this is the vulnerability piece. I had planned to stay in the military for 20 years. And I use the word kicked out. I was administratively separated. And I use the word kicked out because that's what it felt like. And I want to be very vulnerable and very transparent about what happened to me, because I sat in shame about this all for a really long time. And so I made a mistake and I own it. I fully own it. I am not here saying that shouldn't have happened to me. But I felt like I deserved an opportunity, after I had given and served so much. And so it was really hard for me to have gone through and have done all this amazing work and service, and then, to kind of just be let go. And so I didn't know what I was going to do. I had a plan. I had a plan to be in the military, to retire from the military, for that to be my life. And when that wasn't it, I didn't have a backup plan. I didn't know what I was going to do. I didn't know who I was. I didn't know anything about myself. My daughter, who has my grandson, is 28, and I had her when I was 19. So I have been taking care of someone else since I was a child, literally. So I never really knew who I was, and this didn't help, And so here I was out of the military, no idea what to do. This was my life, right? And I was in a crisis. I remember. I ended up landing at a really great company, Booz Allen Hamilton. I don't know if any of you are familiar with Booz Allen, a consulting firm in the DC metro area. Great company, amazing place. They caught me, kind of caught me. I landed there after I got out of the military. And it was because of my service, because of that stellar service, that people at Booz Allen who I had worked with said, hey, we know you're going to do great things. Come work at Booz Allen. And that in and of itself is even a testimony to not have to interview for a job, but to be, kind of walked in the door with, which was awesome. And here I was, this amazing job, this great salary, they paid me well, and great benefits. And I still felt like I had nothing, none of it mattered, because I thought this was what I was clinging to. And I remember sitting at my job in DC, and at my first consulting gig was I was actually consulting for the VA on their electronic health record modernization program. And I was on a VA government computer most of the day. And I was sitting in that office, and I remember just feeling like everything around me was, I couldn't handle anything that people were talking to. I didn't want to talk to people. I didn't really know what I was doing. I wasn't getting the support, that I was used to getting in the military. And I sat there and I felt like I was in a crisis. I really did. And the only thing that I could think of at the time was call the crisis line, because I had seen that so much on the computers. It was like the home screen when you pulled up the computer. It was on posters and all around me. And I didn't know what else to do. So I called the crisis line, and it was amazing. I felt held, once again, they got me connected to my PCM, and I was able to, kind of talk through what was going on and get some help. And I ended up talking to the crisis line probably about 2 or 3 more times over the course of a couple months. And every time I felt like I was in a crisis. I'm like, I don't know what else to do. I don't know who else to talk to. And they literally, kind of got me connected and to where I needed to be. And so I'm feeling like I'm doing a little bit better. And then we got sent home for COVID. COVID happened, and we had to leave the office, and everything shut down, of course. And I was grateful. I'm like, oh, okay, I don't have to come into this office anymore and deal with all these things. And it was the exact opposite of that. I was then very exposed to my stuff, my own stuff. And I was very raw and open, and I was not prepared for that. I'm a parent, and at the time I was a single parent, and I was a single parent in the Navy. And I did that well in the Navy, but as a parent who had gotten out with no plan, I was like, I don't even know how to parent anymore. Like, it was all so kind of like foreign to me. And so that final time I called the crisis line, they got me connected to my PCM, who then, connected me to my mental health provider, and that complementary, like, integrative care and all the things that happen behind the scenes. They got me connected to Whole Health. I got that referral to Whole Health, and that's really, truly where it all began for me. And I felt so supported. I initially got connected with a health coach, and my health coach did the mirror thing. And I did not know until I saw this PowerPoint that was actually part of the model. I just thought it was something cool that she was doing. I was like, wow, this is amazing. But she literally held up that mirror in front of me and said, look at who you are, because I could not see it. I couldn't see any of the excellence. I couldn't see any of the stellar performance. I couldn't see that I was a good mom. I couldn't see any of that. I just saw failure and defeat and purposelessness. That's what I saw. And so it really took my health coach holding that space for me, being present, non-judgmental, smiling with me, allowing me to cry. And I cried a lot, talking to me about my values and what was important to me, things I had never done before. Again, because I didn't know who I was. I hadn't sat down to do any of that. And I remember her saying, "Do you see what I see?" And I'm like, "No." But then I started to see, I really started to see, and it was really nice to see, like, okay, I'm starting to see who I am. I'm starting to understand things a little differently. And I, got introduced to the circle of health, and that circle of health and all the areas around me, me in the center again, was just like, wow, so it is about me. I'm at the center of this all. I am the one who knows what I want for my life. I'm the one who knows what my values and goals and priorities are. No one has to define that for me anymore. It's not about the mission. The mission is me now. The mission is me now. And that was my why. And I had it on a sticky. I saw a comment that said, "Thank you so for sharing my story. Thank you." But I had it on a sticky on my desk that my why really truly was, I want to be healthy, whole, and just full, in my life and in my body. And again, everything was driven by my health. Everything is about my health. And one of the things that I really felt good about was that taking charge. I was able to call my PCM and say, "Hey, this is what I need. I want to do this. I want to try this. I wanted to do all of it." And they were like, "Yes." And I never got told no, which was so amazing. I'm like, wow, I feel so spoiled. I felt so like cradled and held by my team, but it was literally like everything that I asked for, they made it happen. They made it possible for me. And so I started feeling more and more empowered, to speak to my truths and to understand what was going on, and to understand like the mental. I ended up in PRRC. I don't know if any of you probably all are familiar with PRRC, Psychosocial Rehabilitative Recovery Center. And I went through the PRRC program, and I was attending CBT and DBT and self-compassion. And when I tell you I did all the things, just as I was, excellence was kind of where I focused in the military. I wanted to be excellent about me. I wanted to have that same level of excellence about my own mission, because I had given so much to the military in terms of service and my excellence. And I'm like, well, I'm worth that. I'm worth that. I believed that at that point, that I'm worth that same level of excellence. And so I started wanting to just do everything. I wanted to try it all. It was all so phenomenal. And one of the things that was really, really key for me was that it was a holistic program. I am, certainly not, I understand medication and why we need it, and why it's there for a lot of things, but that was not what I wanted. And because I was in control and empowered, I was like, I don't want medicine. I don't want to numb. I want to feel all of this. I had numbed enough. I drank enough. I did all the numbing, and I don't want to do that anymore. I want to feel what I'm feeling so I can understand where it's coming from. And whole health was starting to help me see that. It was those 8 areas of personal development and spirituality and that connection and, all of the things that I was learning about myself. And so I started wanting to do more and more of that holistic medicine, that was the medicine for me. It was my breath. It was my mindful movement. I got certified as a Qigong instructor because of whole health. It was offered to us. And so I got enrolled and certified to actually teach Qigong. And I was doing that weekly at work. And so everything changed for me. And I felt like I was realigned, like, wow, this is amazing, right? And it's truly who I was all along. There was just so many layers and things on top of it, from my personal life, but also from the military. It was a lot, And so it then became, now I want to see what's possible. And that's kind of my theme now. I want to see what's possible in my body. I want to see what's possible. And like, all of the other veterans have mentioned, I've lost weight. I'm stronger. I'm more flexible. I had pain and things like that from the military that I don't feel, I don't have anymore. And when I do, I know how to breathe. I know how to manage it. I know how to massage myself. I learned acupressure and all these other really cool things. Yoga, really having that mind-body connection. I recently started doing man, so much stuff. I'm like, I've done when Ron was showing all the modalities, I'm like, wow, I think I did every single one of those. eye rest and guided imagery. And it was all just so powerful. And so I really want to kind of end there with just saying that it is so important for veterans to feel we are servants, and for the veterans who are on the line, you all know this, that we serve, and we serve fully and with our whole hearts, and one of the things that I have learned through this program, again, is to serve myself first. I've taken on this personal mission to, really share and spread this word of self-love and self-care, and really doing things that make you happy and that bring you joy. I resigned from Booz Allen just about almost a month ago. I resigned on Valentine's Day, which was a huge act of self-love for myself, because as I mentioned before, they were paying me very well. So it was hard to walk away from that, but I knew I had more work to do. I knew I wanted to be in these spaces more often, sharing my story, empowered, free. I am a free bird. I love to play. I love to travel. And so I wanted to do more of that. And that was hugely important to me. So I see a question about nutrition, and yeah, nutrition. I dialed into nutrition classes and things like that. I stopped eating meat, and I got really, really focused on my health. Again, because everything was driving my health, because everything was driven by my health, I'll put it that way. I then became very mindful. I took a mindfulness-based stress reduction course as a result of Whole Health, and I learned how to mindfully eat. And so then at that point, everything about my nutrition changed, because I'm like, what am I putting in my body? Do I want this in my body? How is this going to hurt me, or how is this going to heal me? So my diet and nutrition still to this day, I'm very mindful about what I eat, because I know the impact it's going to have. Everything is a form of medicine, in some way for me. And so I use food as medicine. I use my movement as medicine. I use all of these holistic practices as my medicine. That is what heals my body. And I know that because I feel it. So I want to kind of end there. I know we have time, or we have some breakout groups that we need to do, but again, so grateful and honored to be here and share my story, and just encouraging you all to continue to, to care for veterans the way that you all are doing. So thank you so much.
Thank you so much, Tammy. I could listen to you all day. That is such an inspiring story that you have. And I thank you so much for sharing it with all of us. We are going to move in, and you've got other people chiming in with what an awesome story, and thanking you for sharing that and encouraging us to look toward those alternative therapies and practices and things like that for our whole health. We're going to move into the breakout sessions. I'm going to turn this back over to Allison so she can get you all in the groups. Please look at the 3 topics, pick a topic that you're interested in. Allison will help you get in one. If you do not know what you want to be in, she will pick it for you. Isn't that nice? Allison, you're up.
Thank you, Jeanette. So our 3 topics are motivating veterans. That's going to be led today by Heather Kelly from Travis Manion. And then we're going to have topic 2 is medical issue benefiting from whole health with Ron. And topic 3 is a whole health experience with Tammy, some more. So remember, this is a discussion. So please, I'm going to open the groups, put yourself in. Let's don't spend time introducing ourselves. Let's just go ahead and get to talking. And I'll bring it back in probably about 15 minutes. It's going to be a little shorter today, but that's okay. You guys have a great time. See you in about 15.
Tammy and Ron, right?
Hi, everybody. I am so sorry. I'm sorry that our breakout groups had to be shortened today. I think our problems with technology really got in the way of today's being able to move along like we usually do. So I apologize for the technology issues we had today, and I appreciate you all for being here. I'm going to see about like what about our key takeaways. So on the first group, motivating veterans, that was Heather, right? Heather?
Yes, that was me.
Can
Yeah.
you give us a quick nutshell of some things you guys talked about, like a couple of key points?
Absolutely. I will say, so something we were talking about towards the end of our conversation, Will, who joined us, shared some great thoughts around organizations that do that chapter and connectedness model. I was looking at physical fitness. So we were talking a bit about what Team Red, White, and Blue does, and also looking at connecting people in these communities through digital means. So Will mentioned a website called stackup.org. We were talking about, with RWV and their chapters, how those Facebook groups can be really important to connect folks and motivate each other to these positive activities that really positively impact their whole health in that snapshot. Some folks also brought up a spiritual component to getting involved in motivating veterans, and that some folks see really positive impacts through veteran Bible study groups, things like that. So it was a great discussion.
Excellent. Thank you for that, Heather. And thank you, Heather, for helping us today with our breakout. Really appreciate it. Also, let's see, group number 2, that was medical issues benefiting veterans. Ron, some key takeaways?
Well, sure. So some of the key takeaways were showing them where on our website they can look to see what evidence is behind those complementary integrative health therapies, what they're effective for, what they're not effective for. And we were at how do veterans access these services in the VA. And so there is a locator on our website where you can look and see who the whole health program manager at any of our 154 VA facilities across the country is. It has their contact information, and contact that person. They'll be able to tell you what services are available at that particular VA. And it was a great conversation. I think I talked almost all the time. So I apologize to my group. I am a talker. So, the whole health services, the biggest point in my group was if a provider tells a veteran that's not available here, don't take no for an answer. Look for that whole health program manager. They know what's there.
Perfect. Thank you. All right. And the last one, Tammy, what was a key takeaway or two from your group?
We talked a bit about the crisis line. We spent some time talking about that and how that was really kind of the first little peg that set off, Andrea phrased it very nicely, that domino effect of everything else happening for me. But starting with that call to the crisis line and how important that was. And then we also talked a little bit about how veterans who want to continue to serve and to be in this, place of service, if they're not quite where they want to be, how they can start to take some small actions right in their current situation or their current job and, or their current, the family situation or whatever, to start to give themselves that self-care, and really small actions. Maybe I'm not where I want to be yet, but what can I do in the way of, those little steps to get where I want to be, and making sure that the providers know how to introduce them to all of the things that are available. Because like I said before, I tried all of it and I still do. I'm like, every time they send like these emails out every month and I'm like, ooh, what's on the schedule? This week, what do I want to dial into? And it's really all very exciting. So.
Well, thank you. I'm going to pass the presentation back over to Jeanette to get wrapped up. Jeanette, let me pass it to you.
All right. So thank you. First of all, I want to really thank Tammy and Ron for being on today. And Tammy, your story just keeps rolling around in my head. I'm a social worker, so I love it. And I can promise you what you shared with me today is going to help a lot of the other veterans that I come up against here in the network, and you and Ron's encouragement to let people know about the whole health model. So thank you so much for sharing your story and the information. And I also like to thank all of you for collaborating and sharing. At America's Warrior Partnership, we partner with communities to improve veterans' quality of life and thereby reduce veterans' death by suicide or self-harm. We believe that communities are best equipped to improve the quality of life for their veterans. And our goal here at America's Warrior Partnership, as is our goal every day, is to provide community partners like yourself with support, information, and best practices to help you deliver quality services to the veterans in your community. Our next Battle Rhythm will be April 3rd. Please mark your calendars. On April 3rd, we will be focusing on volunteerism. Researcher Justin McDaniels, along with Matthew Perky from Mission Continues, will be presenting. So we should learn some really good things there and ways to give back to the community and help veterans get involved. So we hope you can attend. Thank you so much for your attendance today, as always, and have a great rest of your day.
Awesome.
Thank you all.